Hey guys, Elena here, physical therapist with Great Lakes Pelvic Rehab and Oxbow Health and Wellness. Here today to talk to you about stress urinary incontinence. Now, stress urinary incontinence is what a lot of people usually think of when they think of urinary leakage. Most commonly, people think about it as normal after having a baby, but it can be entirely independent of whether or not you have birthed a child. And also, it can be very common, but that does not mean normal. No matter where we are in life, whether we are a teenager, whether we've just had a child, whether we're going through menopause, male or female, we should not be leaking urine. Okay? So, ideally, if you are, I would recommend seeking out a pelvic floor physical therapist in your area. Some do telehealth visits, including myself, but ideally, you're getting a full assessment to nail down what's causing this urinary leakage. When it comes to physical therapy, orthopedic, but especially pelvic health, it's rarely one size fits all. That being said, I'm going to do my best to cover a few different ways that we can address the pelvic floor and pressure management to decrease this stress urinary incontinence. Okay, so troubleshooting a little bit at home can help to resolve some of the issue, but if you're not resolving that issue at all, please seek out a professional. Okay, so stress urinary incontinence is when we leak urine with a high pressure activity. So, most commonly, we're thinking about coughing, sneezing, laughing, jumping on a trampoline, picking up something, going up and down the stairs, getting up from a seated position. Stuff like that can essentially increase pressure from above the bladder and allow it to leak urine. All right, so let's back up the bus a little bit and talk about what is below the bladder that provides extra support from below so that we can talk about how we can coordinate that potentially to decrease that leakage. So, I'm a pelvic floor therapist. You know, I'm going to talk about the pelvic floor. I can't not do it, and it's very pertinent to what we're discussing today. Okay, so here is my female pelvis for vagina vulva owners. I don't have a model that demonstrates that for penis owners. Just understand that this can affect those that are penis owners. And the anatomy is very, very similar, just different in a few spaces. But a lot of the cues are very similar. Okay, so this is the front of the pelvis. This is the back of the pelvis. This is our sacrum and our two SI joints right here. Okay, so our pelvic floor is comprised of three main layers of muscle. Okay, so again, front and back. Superficially, we've got the external anal sphincter here, helps to open and close the anus, hopefully when we want it to. We've got the head of the clitoris up here. We've got the urethral opening right here. Obviously, in penis owners, this urethra is a little bit longer. What we can't see in this model is that there's also a little sphincter circular muscle around the urethra as well. We've got the vaginal opening right here. We have some muscles on either side of the vaginal opening right there, as well as some glands. That's that blue bit right there. We have some muscles embedded along the pubic rami here, and then some muscles across the middle. These muscles all have a squeeze function. So when people say, oh, you're having pelvic things, just do Kegels. It's like stopping the flow of urine. One, Kegels are not always the answer, and sometimes they can make the problem worse. We are definitely going to get to that. Two, stopping the flow of urine, we can kind of accomplish with these outer muscles, but that's not really the whole story of what a Kegel or a pelvic floor muscle contraction is. We have a second layer of muscles we can kind of see right here. Those muscle fibers go left and right, okay? They provide extra support to the bladder and the urethra, help to open and close the urethra, again, hopefully when we want it to. Those muscle fibers open and close kind of like those squeezy coin purses where you squeeze and it opens, you let go and it draws taut shut. That's kind of how these muscles right here act. When we get to the inside, we've got these big honkin' muscles. These muscles act like a supportive sling or hammock to the organs. So you can kind of see the tailbone right there. So we've got our rectum, the end part of our colon right here. If there's a uterus, the uterus is in the middle, and then the bladder is right up in the front there. Okay. We also have some hip rotator muscles, the obturator internus muscles on the side wall there. Now, these deepest muscles, the supportive sling or hammock, they do a lifting function. So a full pelvic floor muscle contraction is a squeeze and a lift. I usually say it's like trying to pull a marble up inside your vagina or inside your rectum. That's my go-to cue, but I've found with a lot of different people, depending on what's causing their leakage or their pelvic issue, using some different cues can help to kind of hone in on different parts of these muscle groups to change our continence issue. Okay? So these muscles are under our conscious control as well as our unconscious control. Conscious control is, I kind of have to go pee right now, but it'd be really bad press if I peed my pants right now, right? So I'm making sure that those holes don't open or I don't have a lot of pressure from above. And then later I will go pee over the toilet, hopefully. These muscles are also under our unconscious control, which is honestly a lot of what I work with a lot of private clients and patients, is because those muscles can be holding on to some tension without us necessarily realizing it. Okay, so these muscles can hold on to that tension or grip from any number of things. It can be from having chronic low back pain that hasn't been addressed in a while. It can be from things like endo or adenomyosis that cause a lot of abdominal pain, and then we start to guard into that space. If there's been any sort of abdominal surgery, gynecological or not, I've even had some people have a gallbladder removed and then all of a sudden they're having pelvic floor tightness. Sometimes we have that big trauma to the body and the body responds by tightening up. This includes things like pregnancy and delivery, or even just having increased anxiety, like with the pandemic that's been going on for 3 years and counting, right? If we hold that tension there, it's a lot less obvious than when we clench our jaw or we keep tension in our shoulders. So that's why the answer is not automatically Kegels. In fact, when I'm working with people, it is a rare day that I give people Kegels or pelvic floor strengthening until they have proven to me that they do not have pelvic floor tightness. Because if we tighten a tight muscle, it's not going to make it effectively strong, right? It's like doing a lot of bicep curls up here. Yes, I can carry a lot of groceries in, but I can't reach to put the milk away. These are muscles. Like any other muscles or joints in the body, we want them to have full length and range of motion as well as strength and coordination. And a lot of people that I work with tend towards the tighter pelvic floor paradigm there, in which case now they just don't have that functional strength to try to stop that flow of urine. It's like trying to do pull-ups with T-Rex arms, right? If you're just here, you can't quite do a pull-up. We want to be able to lengthen and then strengthen and go through that whole range of motion so that these muscles can cut off that flow of urine. So in case you're listening to this video and you're saying, well, heck, I don't know, do I have a tight pelvic floor or do I not have a tight pelvic floor? Especially in America, we have a tendency to assume that, especially for vulva owners, oh, everything's just loosey-goosey down there and we just need to tighten it up. That's not really the case. It's very few people that I personally see based on my referral sources, but I'm also just biased towards we just need to provide a lot of attention and love to this area, but it's not necessarily by strengthening the crap out of it. Okay, so you might have a tight pelvic floor if you have pain with sexual intercourse or orgasm. You might have a tight pelvic floor if you have a difficult time starting the flow of urine when you go to pee over the toilet. You might have a tight pelvic floor if you have increased perineal pain. So that is, this whole area that you wipe. If you have increased pain around that area or pain in your lower abdominal area, again, pain that you can't quite put your finger on, but it exists there. And it's been ruled out that you have any sort of organ issue that is causing that pain. A lot of folks that have a history of sexual assault, unfortunately, do have a history of tighter pelvic floor because those muscles are just going into a protective spasm and just not quite letting go. For vulva owners, difficulty having penetrative intercourse or inserting a tampon or menstrual cup, that can be indicative of a tighter pelvic floor. This list is not mutually exclusive, And I have had people that have told me these things and they have not had a tight pelvic floor, but a lot of those reports tend to lend towards a tighter pelvic floor. So if that's the case, avoid doing any sort of pelvic floor strengthening for now. Work on some pelvic floor relaxation and lengthening first, and then add in strengthening at a later time. Again, that's a good indication to see a pelvic floor physical therapist. We can help quite a bit with this. It's honestly my favorite thing to work on with people. But just keep in mind that sometimes this is not always a DIY sort of scenario. And pelvic floor therapy can help a ton here. Okay, so let's loop back to how the pelvic floor and the bladder coordinate, right? So these muscles, they do a squeeze and a lift, and that helps to cinch off the urethra. So let me get my handy dandy balloon here. Okay, so let's say this is the bladder. Not too far off the mark. It is a big stretchy organ that helps to collect fluid or urine as a reservoir until we are ready to empty. Now, if you want to know how to address urgency and urgent continence, I already made a video on this, and this is an entirely different treatment model than stress incontinence. Okay, so we've got our balloon here. The neck of the balloon, that's our urethra here. So my fingers are acting like the pelvic floor where I am cinching it off. No air is leaking out, so no urine would be leaking out, right? Now, if we have a high pressure situation from above, a cough, a sneeze, a laugh, what that does is it puts pressure on that bladder. And if the pelvic floor muscles aren't doing what we want them to do, that's when the urine leaks out. Okay? So what we can do in the short term, whether you have a weak pelvic floor that needs strengthening and bulking, or whether you have a really tight pelvic floor that needs lengthening before strengthening, we can do the same thing in the short term. So what normally happens is we've got our pelvic floor at this normal resting tone. When we have a cough or a sneeze or a laugh or a lift, whatever, that pelvic floor goes down a little bit, and then it springs up into that contraction to cinch off that urethra. Okay? It's kind of like a trampoline. We get a little bit more lift if we go down a little bit first. Okay? But when we leak, sometimes that trampoline goes down to the grass. That's the weak pelvic floor. Or it's just really, really stiff and doesn't have any bounce to it. That's the tight pelvic floor. Or sometimes it's just a timing coordination thing. Especially for those that have delivered babies, our bodies sometimes just get really confused afterwards, and that coordination isn't quite there like it was before. So what we can do in the short term is, if you feel that cough or that sneeze coming, you've got that tickle coming, or you're about to pick up something heavy and your bladder feels really full, any of these situations that would typically cause you to leak, do an active pelvic floor contraction just before. Okay, so what this looks like is, all right, I feel that tickle coming for that sneeze. With the it would normally go down a little bit. Before the achoo, the chew part, you're going to do a squeeze and a lift. Again, like you're trying to pick up a marble inside your vagina or your rectum. Now, if you're doing this and you're saying, Elena, I'm still leaking, what the heck? One, sometimes it's a timing issue. You just can't always get there quite in time because that sneeze or that cough sneaks up on you. Sometimes it is a little bit of a weakness issue, or sometimes it's just, a huge sneeze. What you can also think about is trying to shift that intention of which part of the pelvic floor you're activating. Okay, so instead of thinking lifting up a marble with your rectum or trying to hold in a fart back there, you're thinking about trying to shut off the flow of urine. And you'll feel it a little bit more towards the front of the pubic bone. So again, with our handy dandy pelvic model here, this is the front, okay? If you're thinking about really trying to pick up a marble, sometimes you're overactivating these posterior muscles back here by the tailbone, okay? But if you think about right around that urethra, trying to cinch a hose there, or for those of you that are vulva owners, if you think about the labia like doors that close and meet in the middle, think about trying to close those doors. that can help to shift the focus from these posterior muscles to the anterior muscles. It all counts as a pelvic floor muscle contraction or a Kegel, but it just changes that intention a little bit. And you might be able to cinch off that urethra a little bit more effectively if you think about trying to close the doors or shut off the flow of urine like a valve. Okay, so give that a try. And again, if it doesn't work, don't despair. See a pelvic floor therapist. It's a trial and error thing. Everyone is so different with how their brains and their bodies respond to different cues. And sometimes people get really frustrated when I'm working with them where I say, okay, do this, and it doesn't quite kick in. I go, okay, try this one. I just go through my cues like a list. And then something inevitably clicks in. They go, oh, you mean this? And then there it is. And then we can factor that into exercises and whatnot. So don't despair if you're having a hard time with it. It takes a bit of practice. We are not used to thinking about our pelvic floor region at all. So it's harder to tune in versus saying, all right, do a bicep curl, right? That's easier. We can see it. We can feel it a lot easier. Down here, not so much. It takes a bit of practice. So you have that high pressure activity, stepping up into that high truck, going from sit to stand. Before you do that activity, contract the pelvic floor, find that brace, and then go up. What also helps for the physical exertion side of things, like going from sit to stand or picking up something heavy, is make sure you don't hold your breath. This is a huge factor when it comes to urinary leakage and especially pelvic organ prolapse. When we hold our breath, it squishes in on that balloon and it makes it a lot harder for that pelvic floor to provide that support from below. You've got a lot more pressure up here, not enough pressure down here. Balloon, bladder gets squished and it causes leakage. Okay, so if you're going to pick up, something heavy, it helps to exhale, one, by allowing the pelvic floor to engage a little bit better. And if you want more information on how the breathing diaphragm and the pelvic floor work together, I've got a video on that. It's great. I love talking about that stuff. It also helps to decrease that pressure from above when you exhale with that exertion. So it is less likely to squeeze that bladder from above, so the pelvic floor doesn't have to work as hard to hang on to that continence. Okay, so most of the time when people are telling me they're having leakage with an activity, exhaling is a good first way to decrease that. Doing that NAC or that pelvic floor contraction just before the activity also can help. Now, again, this is a short-term solution. This works in the moment most of the time when you can remember and coordinate it. But at some point, you didn't have to think about what was happening with your bladder and your pelvic floor when you were doing these activities. Ideally, you return to that point where you're not worrying about it anymore. And that's where pelvic floor physical therapy can come in. If those muscles are overly tight and they're not moving through that range of motion and you're having issues, pelvic floor therapy can help to get those muscles to lengthen so that then they can move through that whole range of motion. So again, we're not tightening that tight muscle. If those muscles are really, really weak, doing an appropriate progression of exercises can really help. Again, the go-to here, especially a lot of medical professionals still say this, is they say, oh, just go home and do a ton of Kegels. You should not be doing 100 Kegels a day. It is not necessary. And again, we can send those pelvic floor muscles into spasm. Two, when we think about doing any sort of pelvic floor contraction, it is just as important to relax that muscle in between contractions as it is to contract. If you are, again, to use the bicep, if you are doing that contraction and then relaxing just part way and then doing that contraction, again, releasing part way, that muscle is just going to get tight and spasmodic, but not necessarily strong. You want to tighten and then relax all the way, and then tighten and then relax all the way. When we think about the pelvic floor muscles, it's similar to any other muscle. We want to build endurance and we want to build power. Okay, so we want to do a version of both. When I'm working with people, I will say, sure, maybe you do up to 30 max throughout the day. And we're thinking about doing longer holds up to 10 seconds with a 10-second rest, at least in between. And we're thinking about doing quick contractions. So that's contract, relax, contract, relax, contract, relax. We want to work on both the power muscles and the endurance muscle fibers of these muscle groups. More often than not, though, that is my go-to when people are in the car for a long period of time driving for work, or they're sitting during meetings for a long period of time. My go-to though is to work on pelvic floor strengthening with hip strengthening, with lower abdominal and core strengthening, with a lot of functional activities. It is not just Kegels. I think Kegels are boring. They are not fantastic. They isolate those muscle groups, which is fine. But our pelvic floor muscles work in conjunction with the rest of our body as postural muscles and as core stabilizing muscles. So I like to incorporate a lot more dynamic exercises to challenge those pelvic floor muscles. So keep in mind that if you are seeing someone and they're just telling you to do Kegels, you need to ask for more or ask for somebody different, because there is a lot more to this strengthening of the muscle groups. Okay. They are synergist with a lot of our deep core muscles. They'll work really well with pelvic girdle strengthening, all of this other stuff. So there's more to it than just Kegels. Keep that in mind. But if you're doing this at home, again, find a program that works on core and pelvic floor strengthening. Here's my self promo for my Strong and Bendy course that is going to be coming out shortly. Or at least finding something that incorporates breath and intention with your motion, so that you're not just holding your breath trying to get out as many reps as you possibly can, and you don't actually get to relax muscles in between and you lose form in a hurry. All right. So short term, do a pelvic floor contraction before a high pressure activity. Try to exhale when you can. Long term, make sure you address those pelvic floor muscles appropriately and you don't just send them into a spasmodic, painful land, because that won't go well. Holler if there's any questions. Good luck.